Well, there are concerns about major backlogs that have been experienced in receiving COVID-19 test results. You'll remember the confusion this caused just a few weeks ago about the tally of day-to-day infections. This could be a potential problem where fighting the spread is concerned. Our reporter Mawande Kheswa tracking this story for us in KwaZulu-Natal province, and is joining us now live from our Durban studios. Mawande, good afternoon again. Can you tell us what is the situation regarding COVID test results in KZN?
Good afternoon, Braden. Well, for the most part, provincially, the outlook isn't quite a gloomy one. Everything seems to be going according to plan in terms of ensuring that tests are administered and that results are given to patients. We were able to visit the laboratory at the Albert Luthuli Hospital, where they were conducting their tests as usual. The NHLS took us through the process of testing once swabs do arrive at the facility, where they go and what they do. Now, all of the hospitals do have their own laboratories as well, where they're able to do testing. And for the most part, all of them are operating at a capacity that is adequate to deal with the influx of tests that needs to be done, barring the RK Khan Hospital, where over the weekend we are told that there was an issue where there was a backlog that was created as a result of, number one, from what the NHLS says, is that there's a situation around staff shortages where quite a number of health workers have contracted COVID-19, as well as a situation where there was quite an influx in terms of the work that needed to be done around testing, and that is then what created that backlog, where a number of people who reached out to us had said that they were told that they'd have to wait between 5 to 10 days to get their COVID-19 results, something that is something that people aren't accustomed to. The most that people would wait really is about 48 hours. 5 to 10 days is an anomaly, and the NHLS says that they did put contingency plans to deal with this issue to ensure that by the end of the day, those backlogs that were created on the weekend are sorted out. Let's listen to what they further had to say.
Our turnaround time is not 5 to 10 days for a COVID result. It's normally within 48 hours. The samples from the weekend that were backlogged, they will be resulted by the end of today. Obviously, patients that are suspected of having COVID have the responsibility to isolate so that they do not spread the infection to other members of their family and the rest of the community whilst the result is pending.
Mawande, we know about there's a high number of healthcare workers who are getting infected with COVID-19. I understand you spoke to a trade union. What are they saying?
Yes, indeed. We did speak to trade union, and what they said really is that it is a concern to them that quite a number of healthcare workers are contracting the virus, because this is creating a situation where a number of them who are needed have to spend time away from work. But they say that the solution, according to them, is quite simple. The first one is that the Department of Health ensures that the temp workers that have been hired are turned over and then be put in a system where they become permanent employees. That can help alleviate the pressure and the filling of vacancies that still do exist, and that's something that they say would assist greatly in this issue that they're facing. They also went further to say that the issue of staff shortages is not only affecting RK Khan, but a number of other hospitals as well. And for them, really, the solution to ensure the safety of all healthcare workers as well as patients is ensuring that in terms of capacity, they are at a full capacity in terms of healthcare workers, and ensuring that there is a healthy staff complement is something that they are tasking the Department of Health with, ensuring that they fill those vacancies and ensure that temp workers are then also transferred and made permanent workers.
Okay, thank you very much, Mawande Kheswa, there with that update about the COVID-19 test results in KwaZulu-Natal.